right, ladies and gentlemen, let's go ahead and get started. Today's presentation, brought to you by the CoreVantage program, is Diabetes 101, What You Didn't Learn, a Diagnosis. My name is Kevin Thomas. I'm one of several dietitians that work for GemCare Wellness. Let's go ahead and get started. So an overview of what we'll be discussing today, looking at what's happening in one's body when they have diabetes, discussing the basics of diabetes, looking at how can we effectively manage and control our blood sugars while we live with diabetes, and looking at the importance of not only management, but in support of our healthy goals and lifestyle changes as we control our blood sugars. So first things first, what is diabetes? Well, to summarize, diabetes is a condition where the body's ability to produce or use insulin is impaired. It doesn't work well. This leads to elevated blood sugar levels. In diabetes, there's basically three forms of diabetes that one may live with. Type 1, which means the body doesn't make any insulin. We'll discuss insulin in a moment. Type 2, type 2 diabetes, that is, the body doesn't use insulin properly. And lastly, for women that are pregnant, the body can't manage insulin well, specifically during pregnancy. For many people, they might not be diagnosed with diabetes, but they might be diagnosed with prediabetes. And essentially what it means is that blood sugar levels are higher than normal, but yet not high enough to reach the threshold or the classification of being diagnosed with diabetes. It's a prelude or precursor to diabetes for many people. And action is the best medicine to help control blood sugars so that one doesn't become, or I should say that one doesn't develop diabetes. So what's really going on with diabetes relative to insulin? Well, let's look for a second to define a few key terms here. So glucose is essentially fuel for our body. Glucose is what's produced when the body breaks down, digests, and uses carbohydrates. Think of it as gasoline for our engine. Conversely, insulin is a hormone that acts like a key that lets glucose into our cells. And the easy way to think about it is we have blood vessels similar to a garden hose. And there's blood all throughout our blood vessels. Well, on the inner lining of our blood vessels, or in this case, a water hose, there's a lot of cells. These cells need to open their doors up and accept the glucose that is in our bloodstream. The only way that can happen is if insulin is working properly. So, with diabetes, insulin is, like I said, the key. It's missing or not working very well. And glucose, or sugar, that stays in the bloodstream results in high blood sugar levels. Over time, these high blood sugar levels can lead to a lot of ill health effects, whether it impacts the heart, kidneys, eyes, nerves. It can do a lot of damage in the body if uncontrolled. Proper diabetes management involves not only balancing just what we're eating, but also our activity levels, medications, stress, even sleep is a big determinant on how well one can control their blood sugars. So yes, there's three types of diabetes. With type 1 diabetes, it is an autoimmune disorder. It's just something that happens to some people. What it means is that body produces little to no insulin. Diet and lifestyle does not cause type 1 diabetes. How often people develop diabetes is significantly less as compared to type 2. As little as 5 and up to 10% of individuals living with diabetes have type 1 diabetes, as compared to type 2 diabetes, which is the most prevalent form of diabetes. And what it means, once again, basically type 2 diabetes is insulin resistance. The cells do not respond normally to the insulin that our body, our pancreas, produces. And of all the people living with diabetes, type 2 diabetes represents 90 to 95% of individuals. And lastly, gestational diabetes, it's often diagnosed in the second or third trimester. Many hormonal changes can lead to insulin resistance during pregnancy. 2 to 10% of pregnancies are affected regularly. So, diabetes is something that can be managed, but what's the downside if it's not managed very well? Well, there's several common diabetic complications. These can affect heart disease, or our heart can lead to heart disease, can certainly impact kidneys, cause nerve damage, complications of feet, our mouth or oral health, our vision, our hearing, even our mental health. And as the picture to the right illustrates, diabetes complications results in 30% of all strokes, 40% of all heart attacks, 50% of kidney failure requires dialysis as a direct complication of diabetes. And 70% of all non-traumatic leg and foot amputations are the direct cause of diabetes complications. So diabetes is very serious if we don't control our blood sugars. So first things first, what can we do to better manage one's blood sugars? Nutrition is certainly on the forefront of the lifestyle changes that often need to take place to control our blood sugars. A few key areas for a healthy diet does include, well, managing our portions, trying to keep servings in check to avoid overeating. There could be a lot of changes that one tries to employ in their efforts to control their blood sugars. But from a nutrition perspective, if they're not focusing on portion control as the most single important aspect of nutrition, they should. That should always be the number one goal. Number two says include healthy carbs and proteins in your meals. There are key differences between, let's say, white bread and whole wheat bread. Whole wheat bread, it's less processed. It takes much longer to digest, has more fiber, has more protein, has more B vitamins, all of which are important so that it doesn't speed the digestion of the carbohydrates we're eating. In addition to not just including healthy carbs and protein at meals, it's important to pair the right foods. Try not to eat meals that have just carbohydrates or meals that are completely devoid or missing any carbohydrates. Having a balance of the two does help manage blood sugars effectively, or at least aids in managing our blood sugars effectively. Also, building a healthy plate is important. For example, filling half of our plate with vegetables, a quarter or 1/4 of our plate with lean protein, and a quarter or 1/4 of our plate with whole grains. If one did that, that certainly will help control diabetes dramatically. Now that we know what to focus on, what are some aspects of nutrition should be aware of to avoid? Well, added sugar and refined carbohydrates, whether it be desserts, whether it be soda as a big factor, or any sugary beverages. Trying to cut back on them can really help control our blood sugars. If there was one single aspect that many people that are initially diagnosed with diabetes would be wise to change, it's reducing sugary beverages and trying to cut back on refined carbohydrates. In my example, it could be white bread. It could be bleached pasta. It could be white rice. It could be a lot of cereals are very, very processed. Set them on your tongue. They break down because of the salivary amylase, okay, or enzymes that our tongue has. Well, if it breaks down our mouth, it's not staying in our stomach very long. It's going to raise our blood sugars, potentially too high. Another food to limit, it says foods high in saturated fat. Well, why is that important? Why does diabetes impact the heart and vice versa? Diabetes is an inflammatory condition, which it can affect a lot of organs, specifically our heart. Saturated fat foods raise cholesterol. And if we're consuming a good amount of saturated fats, specifically those from animal sources, whether it's beef, whether it's pork, whether it's dairy, if we're looking at high-fat milk, cheeses, cream, all has significantly high levels of saturated fat, which can be long-term potentially dangerous to our heart. And lastly, trying to avoid excess calories. It's much easier to eat a balanced diet with foods that fill us up, that don't lead to overeating if we're choosing those nutrient-dense foods that I've already discussed. A few helpful tips with regards to controlling portions. So if we're looking at the bottom list, or I should say the bottom pictures on this slide, a healthy serving of protein would encompass the palm of our hand. Vegetables, an example of a healthy serving size would be our fist. If we're looking at what fat might be, so in this example, it could be salad dressings, it could be butter. In some estimation, it could be cheese. Requires the thumb, okay, the top part of our thumb. If we're looking at what would be a healthier serving size of carbs, that, in a perfect world, would make up 1/4 or a quarter of our plate, it essentially would fit in the palm of our hands. Now, if we forget using our hands what might be a healthy portion of particular food groups, using a smaller plate would be advised. A few other helpful tips. When dining out, ask for a takeout box with your meals to save leftovers. Storing our leftovers in portion containers or freezing them for later. Avoid distractions while eating to focus on your meal. It's very easy to overeat when we are distracted. Distractions don't just come from restaurants that might have a lot of loud noise or music playing or televisions playing, in addition to a lot of people talking around you. There's a lot of distractions at restaurants. Some good, some bad. But there's a lot of distractions that we often place in our home environment, whether it's the television, whether it's the internet, whether it's cell phones, whether it's music, whether it's something distracting us from our meal. Avoiding distractions can help us focus on our meal. And lastly, it's encouraged to not eat directly from bags, boxes, or cartons. Why? Studies show time and time again, people eat more if there's more in front of them. Try as best you can, put it on a plate, put it in a bowl, limit your portions. Moving on to the physical activity component of diabetes management. Physical activity or exercise is a significant driver in reducing blood sugars. What is recommended is to aim for at least 150 minutes of moderate intensity exercise each week. Well, for some people, that would be 30 minutes a day, 30 minutes a day, 5 times a week would equate to 150 minutes. Or it could simply be 50 minutes of exercise 3 times a week. For those people that 150 minutes of exercise might seem like a daunting task if they don't exercise regularly, 10 minutes, 3 times a week to get started. Is it as good as 150 minutes? Absolutely not, but it's a start. Types of activities should include aerobic activities like walking, swimming, cycling, really anything that gets your heart rate up. It could be dancing in place. It could be watching a fitness video. It could be a lot of things. In the winter, it could be skiing or snowboarding, ice skating. It's also important to add strength training at least 2 days a week to build muscle and support overall health and strength. Now, if we're lifting weights or using some form of resistance training twice a week, does it need to be 150 minutes? Absolutely not. If one strength trains 10 to 15 minutes 2 times a week, most people would be surprised at how much that can certainly influence and impact our blood sugars as well as our overall strength. Looking at the picture on the right, there are many health benefits of exercise. Firstly, it improves and boosts our energy. It helps us relax. And it improves not just blood sugar, but blood pressures. It limits sickness. It boosts endorphins, or those feel-good hormones. Movement changes mood. It says here, adding muscle as it reduces stress. Well, it certainly helps you sleep. And if we're sleeping better, it helps manage stress. It also improves brain function. So there's a lot of reasons to add physical activity into your usual routine and lifestyle if you already don't. With regards to weight management and diabetes, there's a few associations here. So being overweight does increase the risk of developing type 2 diabetes sevenfold or times seven as compared to somebody who would be at a healthier weight. If we're looking at people that wouldn't necessarily fit within the classification of overweight, but those that fall within the obesity range, that raises the risk significantly more. Depending on the data that one looks at, by up to 10 to 20 times more for developing type 2 diabetes. Does that mean that someone that might be overweight or obese will automatically have diabetes? No. But as the weight goes up and as their age goes up, the likelihood of developing type 2 diabetes significantly goes up. So maintaining a healthy weight can significantly reduce your risk. Weight losses as little as 5 to 7% from one's starting weight can really improve blood sugars. So what does that mean? So take an individual that might be 200 pounds. If they lose 10 pounds, which would be 5% of their weight, statistically speaking, that reduces their blood sugar. Now, if one loses even more than 5% of their body weight, it helps even further. Again, having additional weight or being overweight doesn't mean you will develop diabetes. What it means is it increases your risk, and for those people that might be overweight, losing weight makes the body much more efficient with blood sugar control. Another aspect wildly overlooked when we're discussing blood sugar control and diabetes is the importance of stress management. Physical and mental stress can raise blood sugar levels. Why? Well, it's due to stress hormones like cortisol, which can reduce how well insulin works within our body. Stress may disrupt sleep, appetite, exercise, and medication routines. A few tips to manage stress effectively does include, as we've already stated, the importance of staying physically fit and active. Practicing relaxation or mindfulness, like meditation, certainly helps, like the gentleman in the picture in the foreground. Trying to limit caffeine, which is a stressor for a lot of people. Avoid known stressors, particularly late into the evening. Late in the evening, we need to relax. We're not trying to be stress-free, but if we take on an emotionally charged topic or discussion that will impact our sleep, cause an increase of stress because we're not sleeping well that evening. It's also important to seek support when support is needed. Whether us seeking support might be a health professional, like a counselor, psychiatrist, or talking with friends and family members, just discussing some of the stress that we might face does help manage how well and healthy we approach the stressors that we have in our life. Moving on to diabetes medications. Most people that are diagnosed with diabetes are taking medications used to control diabetes, especially if they're working to control their diabetes long term. Overwhelmingly, the vast majority take medicine. That does help. Not to say they're totally reliant on it, but it certainly helps. So the purpose of diabetes medications helps manage blood sugar levels through various mechanisms. So medications can, quote unquote, attack or direct different mechanisms of digestion, more or less, that help manage blood sugar control. Or I should say the impact on our organs as well. So certain medications reduce blood glucose production in the liver. In addition to some medications improving how well or sensitive the insulin that our body naturally produces becomes. May increase glucose or blood sugar excretion, sugar excretion through the urine. Some medications stimulate or promote insulin release from the pancreas. So there's a lot of mechanisms in which diabetes medications can help. A few reminders: take medications exactly as prescribed. A good number of people that I've worked with over the years, the difference between having very healthy blood sugar levels and having blood sugar levels that are just a bit too high on a very regular basis is simply forgetting to take them, okay, not following doctor's orders. It's important to know your dose, the timing of the medication, the purpose, as well as the possible side effects. Those living with type 1 diabetes, they require insulin. There's no way around it. And it very well may be both long-acting and fast-acting types of insulin. Those living with type 1 diabetes normally work closely with their endocrinologist, which is a doctor specifically dealing in helping patients manage their diabetes. Those living with type 2 diabetes, it may be managed with lifestyle changes, but medications may include oral medications to take by mouth, injectables, insulins, or maybe a combination of both. Some people living with type 2 diabetes might be able to manage their diabetes for a long time, for decades, with just one medicine, whereas other members or other patients might be able to manage their diabetes with 3, maybe even 4 medications. It just depends on their diabetes progression. Being diagnosed with diabetes, one might often be encouraged to be checking their diabetes. Well, why? Well, there's a lot of different testing methods out there, but essentially why testing helps, excuse me, specifically why testing helps with blood sugar control. Well, if we're checking our blood sugars, we can spot the highs, we can spot the lows. We can look for trends within our blood sugars. We can see how well medications happen to be working. We can see our overall progress in managing diabetes and meeting our doctor's treatment goals. If we're checking our blood sugars, we're going to understand very quickly how diet and exercise affect one's blood sugars. We can learn how factors like illness or stress impact blood sugar control. So there is a couple different ways to check blood sugars. If we're looking at the picture on the right, this would be a blood glucose meter, which is a device that uses a manual finger stick to provide a single blood sugar reading in the moment on the spot testing. Also, with increased popularity over the years is continuous glucose monitors, or CGMs. What this is, it's a small sensor placed on your skin, typically the backside of your arm or tricep, that measures blood sugar levels every few minutes, providing continuous updates. Typically, those updates would be Bluetooth to one's smartphone. So if you wanted to check your blood sugars 5 times a day, 10 times, 15, 20, you could do that all without having to prick your finger. So if we are checking our blood sugars, there are certain numbers to know. Okay, so on the far right, there's a couple different time periods that's often advised to be checking your blood sugars if one is checking their blood sugars. So number 1 would be fasting, or when one wakes up, basically before breakfast. There's nothing in their stomach. They just woke up. Well, normal fasting blood sugars without diabetes, under 100 is recommended. The American Diabetes Association, their goal is from 80 up to 130. So the fasted goal is to keep it under 130. The American Association of Clinical Endocrinologists, their goal would be a little bit tighter. It's under 110. As a general rule of thumb, the fasted goal for those people living with diabetes in the morning is to keep their blood sugars under 130. Now compared to people that might be checking their blood sugars after a meal, 2 hours after a meal. Well, what would be considered normal without diabetes? Under 140. With diabetes, according to the American Diabetes Association, under 180 is a good target to hit 2 hours after a meal. In the American Association of Clinical Endocrinologists, their goal would be under 140. So again, not saying everyone needs to be checking their blood sugars, but for people that are checking their blood sugars, these are important numbers to know. Now, if we're looking at the bottom right, it says A1C. So what A1C is, essentially it's a blood test you would have to get at your doctor's office. And this blood test represents how well one has been managing their blood sugars over a 3-month time frame. It's a very simple test. Normal A1C levels without diabetes is under 5.7. The goal for those living with diabetes is under 7 itself. Versus the American Association of Clinical Endocrinologists, their goal is under 6.5. Typically, if one has an A1C of 7, it's often recommended, let's see if we can get it down just a little bit further. And this number is not out of 100. So the difference between an A1C of 10 and an A1C of 7 is significant in the world of diabetes. Significant. So a few questions that is recommended to ask your doctor, okay, specifically with blood sugar monitoring. Well, ask your doctor, what would you recommend for my target range? How often should I be seeing certain numbers? And why? When should I be seeing these certain numbers? How often should one check their blood sugar? That's a very important question to be asking your doctor. And a lot of times this will be reflected in how well your blood sugar is already managed. If one's blood sugars are very high, maybe checking our blood sugars 3, 4, 5, maybe even 10 times a day using a continuous glucose monitor in the background, the foreground is a picture. That's exactly what a CGM looks like. But maybe checking it several times a day for the first week or two is recommended so that we understand the influence that food, exercise, stress, and sleep can impact our blood sugars. Also asking your doctor, what type of blood sugar monitoring should I consider? Should I get a handheld glucometer or glucose meter? Or should I be using a CGM or continuous glucose monitor? Lastly, do we need to adjust my treatment plan only through looking at labs like an A1C and seeing where our blood sugars are at in addition to us testing our own blood sugars and bringing that information to our doctor? That often gives the doctor a lot of information to make the best recommendation or treatment plan for your blood sugars. And lastly, an important tip says have regular check-ins with your diabetes care team to stay on track. Why that is important is because diabetes, similar to high blood pressure, can be the silent killer. We might feel fine, we might feel normal, even when our blood sugars are ever increasing. Well, that can impact a lot of our organs that we've already talked about earlier. So don't be misled by how you feel relative to how often you see your doctor. Don't miss your appointments. For those people that are either for those people that might be diagnosed with type 1 diabetes, or for people living with type 2 diabetes that just isn't managed nearly as well as it should be. For some people, this could be within the first couple of years of diagnosis with type 2 diabetes. Others could be a couple decades down the road. Some might have to use an insulin pump. And you see a picture in the background on the far right of what one of them looks like. So an insulin pump is a small device worn outside the body that delivers insulin through a thin tube placed under the skin. It's designed to closely mimic how a healthy pancreas releases or provides insulin. The insulin is provided in a steady stream of background insulin. It's called basal insulin. So basically not during meal times. Compared to the insulin pump delivering a larger dose of insulin known as a bolus at meal times or when blood sugar is high. Insulin pumps allow for more flexibility with meals, physical activity, and daily routines, and they can help improve blood sugar control when used consistently and correctly. I've worked with many people, many members over the years who use insulin pumps. They can be absolute game changers for those people that need them. So, how can CoreVantage or the CoreVantage program help you? When you join Edwards Healthcare Services, or EHCS, and enroll in the CoreVantage program, you get more than supplies, you get a full support system. So, working with Edwards Healthcare Services, automatic refill reminders so you never run out. You'll be provided with personalized coaching from registered dietitians like myself. And one thing I encourage, as do the other dietitians, there's no one best approach to this. There's no cookie cutter plans. We want to help you figure out your plan to best manage your diabetes. We provide educational resources on diet, exercise, and wellness. The folks at Edwards Healthcare Services will help navigate insurance and coverage, and a dedicated care team is here to keep you consistent, confident, and in control. So it's not about being perfect. It's about creating a routine that works for you. And Edwards Healthcare Services is here to make that much, much easier. All right. So that concludes today's presentation. Is there any questions I might help answer today? All right, everyone. Thank you very much for your time. Take care. Have a great day.